control of our health care decisions based on trust me. Let's ask John Fleming, a Republican congressman from Louisiana. Congressman, what would you say to your colleagues across the aisle? Let me go that on the left side. Should they trust her?
Well, I honestly don't think they do trust her, and I would say don't trust her. With the stories we're hearing through the back wards here about how Democrat members are pressured or legion, and I think what we're hearing now, some of the things that are reaching the service are just really the tip of the iceberg, the sort of intense pressure that's being put on Democrat members to pass this thing.
Well, give us some of the inside scoop, Congressman. What are you hearing? What are these pressure tactics? Well, I mean, we've been talking about this on the show, you know, the judgeship, and, you know, Eric Massa claims that he was pressured to resign.
In the men's locker room without
yeah,
whatever.
I mean,
right.
You know, he doesn't have a whole lot
Absolutely.
of credibility because of the harassment allegations. But give us what you've been hearing aside from those two things.
Well, you know, Parker Griffith is another physician who was a Democrat who recently switched to Republican. And one of his main reasons for that was, number one, he said he could not trust Nancy Pelosi. He could not, and many of his friends could not, and that the pressure to do things against their conscience was often very intense. And certainly if there's any potential legal or ethical issues that could be used as a pressure point, that they don't hesitate to do that on the Democrat caucus.
Representative, you know, you talk about the Democrat side and how you guys, the Republicans, don't trust them. Well, why should the American people trust the Republican side any more than the Democrat side anyway? The last 8 years when you guys were in power, we saw expansion of Medicare and Medicaid. We saw socialization of entire financial markets, $1 trillion worth of bailouts. Why do we think you guys will do any better?
Mea culpa. I was not here then.
It's just not enough.
Well, absolutely. The Republican Party was bad boys and girls as well over particularly the last 5 years, spending money like drunken sailors. But, you know, the Democrat Party, when they took over to be the adults in the room, they took spending into hyperdrive. We went from the frying pan into the fire. So I don't think either side can really make excuses. I think we have to stop spending now, not next year, not any of these fake pay-as-you-go programs. We just need to simply stop spending and bring our budget into balance immediately.
Congressman, can you shed any light on, you know, again, I'm going to ask you to kind of do us a favor here, give us some inside baseball on this. Bart Stupak has said so far the language he sees isn't good enough. If they change the language, the abortion language I'm referring to, if they change it to the point where he's okay with it, aren't they just going to lose a lot of liberal left Democratic votes in the House?
Well, that's quite possible. The question is, are those liberals willing to hold their nose and accept? You know, they did the first time. The Stupak language was in the first version, but they were promised that it would be taken out later. And the question is, who trusts who over there on the Democrat side? I would suggest to you that Democrats are not trusting Democrats. The congressional members, the House members are not trusting the Senate and vice versa. So where that ball is going to land is really very interesting.
We should also talk about, Congressman, I know Eric wanted to hit on this as well, when you know, your contention here is that, hey, if the Democrats want to pass health care, then they better sign on and say that they will use this specific health care for their insurance as well. You know, you were making the point, Eric, that's kind of a flawed argument.
My point was, aren't you giving them an easy out to say, hey, by the way, I'm only doing what you said. Sure, I'll take that health care. You guys get paid very handsomely on the Hill.
Well, it's not only that. The health care we get is private insurance, and it's Cadillac program, no question about it. But the government pays 3/4 of our cost. And I can tell you that private employers under this health care plan will not be able to pay that.
But
and so while
I think Eric's point is that whether they're paying 3/4 or 0 of your health care costs, it's a rounding error for a senator or a congressman, whereas for the American public, it's very meaningful.
Well, absolutely. But the point I'm trying to make is that many will be dumped into Medicaid, and as a result, they won't be able to enjoy the same plan that the members of Congress do. And so in my resolution, 615, launched last July, and over 3 million Americans came to my website in support of it, it simply says that members of Congress should abide by the same laws and rules and standards that everybody else in America does with respect to a health plan. That means no public option, certainly the option not to be in Medicaid or any other kind of government-run system.
All right, Congressman Fleming, thank you very much for joining us today.
I think it's an easy way out. It's too easy.
Thank you.
I think it does provide cover for the Democrats, because then they can go, okay, fine, we'll give you that one. And you guys will sign now,
But it
right?
also has